Hello, my name is Lee Van Diniz. I'm a radiologist from Brazil, and this is Toria's Radiology. That is my YouTube channel to discuss about some topics in CT scans, MRI, and ultrasound. Maybe in the future some contents about education methods and learning processes. But let's go together now. We're going to discuss our first topic, a very important theme in radiology and neurology as well. That is brain herniations. So we are going to describe firstly the concept of brain herniation, and brain herniation is defined as a shift of cerebral tissue from its normal location into an adjacent space. This condition is a life-threatening condition, and that's why it requires prompt diagnosis. And because this is a very deadly situation, we have to learn with someone who knows more about this topic. And that is the school. And the school is showing us the book that rules its world. And that book is called Law of Naru-Kelly, the Naru-Kelly's Law. So to know more about that, we have to take a look inside that book and see what is right there. So, the Naru-Kelly hypothesis states that the cranial compartment is inelastic and that the volume inside the crane is fixed. So, if something increases inside the cranial compartment, we will have a decrease in the other compartments. Now we have to go deep in these concepts, and we're going to open this skull to see what are the things that are inside the skull. So we're going to dissect the frontal bone. And so inside the skull, inside the cranial cavity, we have the brain tissue, we have blood, and we have CSF. So the cranium and its constituents create a state of volume equilibrium, such that any increase in volume of one of these cranial constituents must be compensated by a decrease in volume of another one. So let's say that this patient have brain edema. And if the patient have brain edema, we will have an increase of the volume of the brain and a decrease in the volume of the blood and CSF as well. So that's our second patient. A patient who now is blind, and he was diagnosed with brain tumor. So this patient have brain, blood, and CSF as well. He's a normal patient. But he discovered this brain tumor. So this brain tumor is increasing its volume inside the cranial cavity. So we'll have a decrease in the brain, in the blood, and the CSF as well. And now we're going to discuss about the types of herniation. And the first type here, we can see some cerebral tissue going all the way throughout the skull, and that's an extracranial hernia. So this is the only extracranial hernia. The others are all intracranial hernias. The second one is the hernia. The cingulate gyrus will go all the way through and pass the falx cerebri, that is this structure here. It will go to the other side, and that is called the subfalcine hernia. The third hernia here is this hernia that is centrally located and is descending, and the reference here is the tentorium. of the cerebellum. So that is a descending transtentorial hernia, a central descending transtentorial hernia. So that is a central, that is a lateral descending transtentorial hernia. We have other hernia here that is called the tonsillar hernia, because the tonsilla of the cerebellum will go all the way down to this foramen that is called foramen magnum. This hernia here is called the ascending transtentorial hernia, because the part of the cerebellum will go all the way up and pass through this structure that is called the tentorium of the cerebellum, and that is again the tonsillar hernia. So we can have some complications here. If we have something increasing in the brain and we have a brain herniation, maybe we can have a compression in the blood vessels, and this compression can lead to that the blood will not get to find the tissues, and so we'll have anoxia, ischemia, and necrosis. So that's an ischemic stroke, and the patient may have increase in the blood pressure and maybe a rupture of the vessel. So it can cause a hemorrhage. Another complication of brain herniations is the compression of cranial nerves. And the clinics of the patients will depend on which cranial nerve will be compressed. The most important cranial nerve here that will be compressed is the third cranial nerve, and we're gonna talk about that. So, when you have some obstruction in the drainage of the CSF, we have a build-up in the brain. The CSF will build up in the brain. So we have this complication that is called hydrocephalus. So we will have to have the systematic approach to see every single CT scans and every single MRI of a patient with brain herniation. We have to know the clinical information of the patient. We have to know the neurological syndromes. We have to know all of the clinics of these patients, the history of this patient. We have to know the anatomic landmarks, and we're gonna discuss about that in each herniation, subtype of herniation we're going to discuss. And we have to know the direction of the mass effect, where these structures are going to, and which structures they are displacing. We have to know the indirect signs. We have to know the compressions of the ventriculars. We have to know the effacement of the cisterns, and we have to know the shift of midline, and we have to know about the shift of the membrane. So, and last but not the least, we have to know about the complications. And we're gonna talk about complications of the vessels, like I said before, of the nerves, and of the drainage of the cerebrospinal fluid. So that's it for now. And after that, we're going to discuss about all of this type of herniations. But that's it for now for this video. Thank you very much.